could be someone who's been trying for a baby for quite some time and very excited about getting pregnant. Or you could be someone who never even thought about a pregnancy or a baby, but you've had unprotected sex and now you're scared that you may be pregnant. Whatever situation you are in, I can totally understand that it can be very, very difficult to wait and to know when to take a pregnancy test. So in this video, I'm going to tell you about when to take a pregnancy test and how to take a pregnancy test. Now, before we go about on when to take and how to take, what you will have to understand is that any pregnancy test will measure something that we call as the HCG hormone, that is the human chorionic gonadotrophin hormone. This hormone is produced in our bodies only during pregnancy. So it is easy to check or confirm whether you are pregnant or not by measuring the levels of this hormone. Now, there are two types of pregnancy tests. One is the urine test and one is the blood test. Now, the urine, both will be measuring the HCG hormone, but a blood test will be able to measure the HCG hormone a bit earlier than the urine test. Okay, now when we take the urine test is usually, very cheap. It's easily available in all the pharmacies, so you can access it very much faster. And the result is also very quick. It will just take you anywhere from 2 to 5 minutes to know the result as well. So because this is very easy, this is usually much more preferred by a lot of women. And, it is much easier for you to do it at home as well. Okay, so this urine test will require either one, that is you'll have to take a couple of drops of your urine and put it into one small hole that is there, designated spot that is there, or you may have to hold the chemical strip in a stream of urine or dip it into urine and take it out and then wait for a couple of minutes before you can see the result. So I would recommend that you read the instructions given by that particular company for the brand and follow the instructions, because it may differ from each brand of urine pregnancy test that you are going to take. Okay, so now this urine test will measure the amount of HCG that is present, and it will tell you whether you are positive or not. Based on the brand that you have, it could be with the presence of 2 lines or it could be with the presence of a plus sign on the urine pregnancy test. If you're going for a very hi-fi costly urine pregnancy test, it could even show you, positive, not, pregnant and not pregnant. It will blink. Okay, you'll have a screen where it shows you whether you are pregnant or you are not pregnant. So this is how the urine test will be. Now, when we talk about the blood test, you'll have to give your blood to a lab where they will check for HCG. In the blood test, there are 2 different types. One is called the qualitative test and the other is called the quantitative test. This qualitative test will just give you the answer of yes, you are pregnant, or no, you are not pregnant. Whereas the quantitative test will be able to measure the amount of HCG that is present in your body. So now, why is this quantitative test recommended or needed? It is especially needed for somebody who's having trouble becoming pregnant, or somebody who's taking fertility treatments, or you've had earlier miscarriages. Then your doctor may recommend that you go for this quantitative test, that is also called the beta HCG test, that we commonly call as the beta HCG test. Okay, so why would your doctor recommend a beta HCG test over a urine test, or after you've taken the urine test, is because in this your doctor will ask you to measure it on one day and then give another blood sample after a couple of days or a week to see how much the HCG levels have increased. If the levels have increased according to what is recommended and your doctor is happy, then it means everything is okay. But in case the increase in the level of HCG is not adequate and it is not good, then your doctor may ask you to wait and watch or be cautious for a couple of days more and then redo the beta HCG test. So this is something that is best discussed with your doctor, and your doctor will be able to give you more advice that is best suited for you as a couple. Okay, so this is about the 2 different types of tests, the urine test and the blood test. Now, when we talk about can we get a false positive or a false negative? Yes, you can. False negatives are more common. Why do you get a false negative? Is because you may be pregnant, but the amount of HCG in your body, in your urine, is not high enough to be detected by the urine test. So in case you have gotten a negative urine pregnancy test, but you have not gotten your periods after a couple of days or even a week after you've taken the test, then redo the urine pregnancy test. This time you may be able to get a positive in case you are truly pregnant. Okay. Also, some of the things that you will have to remember when you are taking the urine pregnancy test is try to do it early in the morning in the first urine that you pass for the day, because it will be very concentrated. So it will be easier to measure the amount of HCG that is there. Second, always follow the instructions given on the package by that particular company because it will be easier. 3, do not wait for too long. That is, don't go beyond 8 to 10 minutes to check for the result, because at that time, all the urine may have evaporated and you will most likely see 2 lines sometimes, even if you are not pregnant. This is called the evaporation line, and it's caused because all the urine has evaporated. So this can be like a false positive for you. So always check the test within the given time that the brand has recommended for you. Okay, and also always check the expiry date on the package, because you do not want the chemicals that is there in the chemical strip to check for the HCG could be expired. So you do not want to get a false positive or a false negative and become very anxious. So please always check for the expiry date on the package. Okay, so these are some of the things that you will have to follow when you are taking the urine pregnancy test at home. Okay, now can I get a false positive? Yes, in some cases you can. For example, if you have gone for a fertility treatment and you have been given an HCG injection during the course of the treatment, then you can get a false positive. In case of some forms of tumors that are present in your body, yes, you can get a false positive. And sometimes if you are in the premenopausal stage or you are on the onset of going into menopause, then sometimes because of all the hormonal changes that are happening, you can get a false positive. Sometimes if you've had a recent miscarriage or you are having a chemical pregnancy, that is, there's no fertilization, but then there are other signs, or the fertilization takes place but there's no amniotic sac, such type of pregnancies also, they may not last, so they're not considered as proper pregnancies, they're called chemical pregnancies. In these cases also you can get a false positive. So it is always advisable that in case you have any doubt with the results, you can wait and redo it after a couple of days, and if it continues to be very puzzling for you, always contact your doctor. They will be best, they will be able to guide you best. Okay, so now that you know when to take the urine pregnancy test, how to take the urine pregnancy test, just remember a couple of extra tips. That is, always wait till your period's date, the date that your menstrual cycle will usually start, to do your pregnancy test. If you do it very early, it could end up with a negative because your body does not have the enough amount of HCG to be measured. Second, always, even if you get a negative on your period's date but you have not gotten your periods, please wait for a couple more days and then redo the test, because in case fertilization took place in the second part, not exactly in the middle of your cycle, but towards the end of your cycle, for some people it can happen. So if it is like that, then your body will need a few more days to register the pregnancy and for the increase in HCG hormone to be reflected in the urine test. Okay, so redo it if you have not yet gotten your periods again. And do not wait for too long after you've done the urine test to see the result, because it can lead to a false positive because of the evaporation lines. Always follow the instructions on the package. And then if you are planning to give a blood test, you can always talk to your doctor on what type of blood test, whether you need a qualitative or you need a beta HCG, and you can do it. Okay, so don't panic. I understand it's very difficult to wait, but those 2 weeks, that is, waiting till the date of your menstrual cycle, is very, very important if you do not want to be very confused on what type of result is going to come, and to get a very confident positive result, right? So all the very best. Take care and stay tuned for much more videos. If you like the content of this YouTube channel of Babypedia, please do hit the subscribe button and do like the video and comment what you think about the video. Take care and bye-bye.